So the first one is talking about physician assistants or physician associates, depending on which group you're talking to. So like Ed had already said, New Hampshire does wonderful in nurse practitioners and allowing them to be able to operate in a way that they're able to work to the full extent of their training. This means that they don't necessarily have someone looking over their shoulder. They're able to diagnose their patients. They're able to come up with treatment plans. They're able to refer their patients and they're able to prescribe medications. Physician assistants, which have similar medical training, often do not have the same ability to be able to interact with patient care. But as Ed had also said, all 10 counties have some suburbs or rural areas that don't have the same access to healthcare of what we would expect that we would have in other areas. So while these are generally less independent than nurse practitioners, they often have some of the medical training to be able to have these frontline contact hours in primary care. In the physician shortages in the United States, which are projected to be about 135,000 physicians in primary care short by 2030, which is a staggering amount, physician assistants and nurse practitioners are far more likely to actually service primary care patients, while physicians themselves are more likely to specialize into things such as cardiology or surgery or many of the other things that we're more used to accustomed to hearing. So physician assistants have really also brought into this next level of being able to have some sort of patient contact hours in areas where we may not be able to have the critical amount of physicians that we need available for patient care. This is really important when we might have demand surges. Like Ed said, we think mostly in supply and demand. Well, if demand goes up, we also need supply to go up. This is something that we learned very, very rapidly during the COVID-19 pandemic. And it's something that we still try to figure out what we can do today, because some of the temporary measures at that time allowed us to be able to look at the quality, access, and care concerns for being able to make some of these policy provisions. Allowing physician assistants more autonomy over their jobs allowed more healthcare professionals to move to rural and suburban areas and service patients. We've seen similar policies do very well in North Dakota and Utah, which have passed similar laws in 2019 and 2021 to expand these practices. Another reform that we think is actually a great idea is looking at pharmacists. So Idaho recently allowed pharmacists to expand their prescriptive authority to be able to have contact directly with patients. It turns out physicians are very, very good at, for example, prescribing insulin for diabetic patients, but they're not always good at remembering to prescribe the needle that you need for insulin injections. Allowing pharmacists to have some autonomy over their ability to prescribe things such as insulin needles or fast-acting inhalers or other emergency medical treatments for necessary needs. Allow it so that patients don't have to go back through this medical system, go see their primary care physician again, go back and have contact hours that might take away time from physicians providing primary care, but also to have things that are not for new diagnoses, but they're supplies that these patients have already had multiple times over. Allowing pharmacists to have these sorts of abilities to be able to prescribe things such as needles for diabetic patients or inhalers for people who are out of their inhaler but don't have the ability to see their primary care physician right away can help not only increase access to crucial medical services, but can increase quality and outcomes for these individuals. A second reform that we think is very crucial is the idea of physical therapist. So New Hampshire actually has a little bit of an odd law. Physical therapists can see direct access care for patients, but they're limited to only 25 days of direct access care. Well, if you're a patient going in and you're seeing your physical therapist, are you really wanting to see them as this direct care individual if you know after 25 days you're going to have to go see a physician anyways, which means you're going to have to develop a new medical relationship with a new practitioner? That might end up drawing some patients away from this really great alternative that already exists in New Hampshire because of a cap on the number of days that they're able to make this sort of contact. Being able to address something such as just the cap on the contact days for physical therapists is an easy policy change that can have massive effects on being able to increase access in areas that are largely underserved or may not have the ability to have full-time physicians available for the amount of patients in the area. A fourth reform we like to think about is, it turns out it's not only physicians. We also think about dentists, ophthalmologists, optometrists, psychiatrists, psychologists. Dental therapists are actually a really important frontline worker when it comes to being able to maintain dental care. Having preventative dental care can make it so that people are much less likely to have long-term dental health issues, which might cause a variety of different things such as infections, loss of teeth, larger Medicare and Medicaid needs further on. So 8 states have authorized dental therapists to go one step further, to be able to work on those cracked teeth, to be able to put in their own labs, to be able to take their own x-rays, and to be able to expand their scope of practice to have some things that they can operate on by themselves without needing a dentist to be present. They still have 3 years of education where they are trained on all of these specialized services, such as cavities, crowns, teeth extractions. And in the 8 states that have allowed dental therapists to be able to work independently with their patients, we've seen really great outcomes, such as more dental care available, especially in areas where you may not have full dental service available 5 days a week. The last one that we're going to give you is psychologists. This one's really important to me, mostly because it's something that I research and I've spent a lot of time looking at. In 5 states, Idaho, Illinois, Iowa, New Mexico, and Louisiana, psychologists can prescribe medication. Of course, they have the great pharmacological background. They've taken multiple years of training for how to be able to properly prescribe medication, similar to their psychiatrist peers. But being able to have psychologists prescribing mental health medication can get mental health medication to people who are suffering from mental health disorders 6 to 8 weeks faster. This has reduced suicide rates, and it has also made it so that we have more psychologists who are able to practice independently and start new practices in locations that had no mental health care before. Which in New Hampshire, there are areas within all 10 counties that do not have a practicing psychiatrist that can prescribe medication for that town or city. Having psychologists prescribe medication is an alternative to being able to bring care to people who have had no care previously and need to or currently have to drive for hours or for 35 minutes to be able to get to that next care location.